I guess it's been, 3 weeks now that Prime Minister Trudeau stood at that exact same spot and put out a call to Canadian companies to help amidst this COVID-19 pandemic. And it seems like many of them have answered the bell. What more do we know on that?
Yeah, saying today that places like Stanfield's and Canada Goose are now going to help to make medical gowns that will help for frontline workers. Talking about a variety of different companies that they've put out the call to, and they have answered that call to try and help with that, saying that 30,000 ventilators are on order now. And the question that came right after that was, well, do you think we're going to need that many? And the Prime Minister basically said, look, we're not sure yet, but we'd rather have too many. And if we get to the point where we don't need them and we can sell them to other countries or send them to other countries to help them, then maybe we can do that. So clearly they're sort of gearing up, as we've been putting it, of, Industry Canada to try and get behind this and help with all of this procurement and even making it on our own. The Prime Minister has been saying this for well over a week now. Instead of trying to buy it from other different countries and getting to the issue like we saw with 3M, Canada wants to make it within our borders, try and make sure that we are self-sufficient on the supply of these things, ventilators, those N95 masks, medical gowns, to make sure that we don't run out, so that we're making it here at home. We know, this has been well documented last week, the Auto Parts Manufacturers Association has been retooling some of their members' manufacturing plants to make sure that they're now making ventilators and that sort of a thing. So clearly the call is being answered, and at this point it's a question of how quickly can we get these into service. Clearly the Prime Minister is saying that it looks like it could be weeks for some of those 30,000 ventilators, which may coincide with the peak. It's unclear yet, but that effort is clearly still ongoing, and obviously, it looks like industry is ponying up and doing this when you consider, places like Canada Goose and Arc'teryx, which is a Quebec company that both do winter coats, that are now retooling and making sure that they help in this effort. This is something that we really haven't seen since, the last war.
Yeah, but the big question, and you touched on this, is the timeline, because we are in the throes of this public health crisis, and it's going to take some time for them to come in. Many businesses have answered the call. The question is whether it will be enough, when we need it. And I want to touch on some of the numbers that we heard. Really a startling number regarding the application process for CERB. Obviously, there are many people who still are not eligible. Some changes on that perhaps in the coming days, but close to 1 million people already.
Yeah, 966,000 people applied just yesterday alone, and those are people with birth months of January, February, March. You have April, May, June that are going today, so we could see those numbers just as high. And as we mentioned just before the Prime Minister spoke, upwards of well over 3 million who have applied in general for EI. Those are now in the CERB stream, and over 3 million now have been processed. So the government kind of tooting its own horn there, saying, look, we're doing pretty well.
Yeah, there's no question. Okay, we'll leave it there for now. Mike Le Couteur in Ottawa. And let's stay in the nation's capital and bring in our Ottawa Bureau Chief, Mercedes Stephenson. And some news surrounding the proposed wage subsidy, of course. But I want to touch on as well, we talked about the medical equipment that came in, and sort of a question expanding on what we were talking about with Mike and whether we are prepared enough. Janet Silver, our producer, asked the Prime Minister that question. Because yes, these companies are answering the bell, but the question is, why weren't we, given what is happening or what happened in China and other countries, why weren't we more prepared? He kind of skirted that, didn't he?
Yeah, and it's a question we were asking about testing the other day too. And I think everyone recognizes the government is trying to do their best here, but there's some serious questions about why there weren't greater preparations. We could see what was happening in China. We could see what was happening in Italy. So was there an attempt to try to acquire the amount of potential masks and equipment and ventilators and tests that Canada might need to do that? Was there enough done in terms of contact tracing to figure out where infected people have gone? And you heard that very first question, too, from another reporter saying, there's been changing public health advice on closing borders, on wearing masks. When you look back, do you think maybe you should have done some of these things earlier? And they are maintaining on that file that, they're always looking back. They're focused on the now. But there are some accountability questions here in the long term for the government. Now, to be fair to them, no government has been prepared for this, and everyone saw it and saw the warnings. But there's still some questions there about whether enough was really done to make sure that that federal strategic stockpile was in place. I think it's a big learning experience for both provincial and federal governments, and it's important for us to point out there that healthcare is actually a provincial responsibility. So while there's a federal stockpile, it's also up to the provinces to make sure that they had the equipment heading into this and to start preparing. And it seems like there may not have been movement as early as they in retrospect would have liked there to be. And there's still questions, because there were still questions about the masks and whether or not to wear them right up until yesterday, when Canada's top doctor said, look, if you want to wear one when you're in situations where you can't be socially distanced, not medical masks, just a basic cotton face covering to prevent the spread. And the Prime Minister referenced that too. You can do that, but it's really important you still maintain your physical distancing. You don't touch your face, you wash your hands, all of those kinds of things. But there's certainly some questions there too. There's also questions about China, because the government had said repeatedly that they trusted the numbers coming out of China. U.S. intelligence reports and Canadian sources say that they don't believe that the Chinese were fully disclosing the extent of the pandemic. Did that affect the Western response? And those are questions that we still really don't have the answers to.
Yeah, and the distribution of this equipment is a big issue between the province, and you hope that it's going to get to the provinces that need it the most, at least right now. Ontario and Quebec and Alberta saying that their peak maybe weeks away. Of course, we'll be watching that very, very closely. Mercedes, thank you so much. Let's head back overseas and bring in our Europe Bureau Chief, Crystal Goomansingh, joining us from London. And Crystal, the Prime Minister was asked about the rapid testing kits. The UK has some experience in this. Not always positive. Shed some light on that.
Well, everyone around the world right now is trying to come up with a way to test more people. You know, there's questions to Prime Minister Justin Trudeau about why you aren't testing enough people. The exact same questions are being asked here of officials in the UK. Now, officials here have ordered all sorts of different kind of tests. There's several different ones. There's the swab one, which we've seen a lot of. There is a antibody test, which is a blood test to determine if you've actually had the virus, and then and then you can maybe go back to work or get back out there, and that's particularly important for healthcare workers. But then there's also this rapid test. But before these items can be deployed in large-scale use, not including the swab test, they have to be tested themselves to prove that they work. And there were some challenges with the rapid test where they were failing at a higher rate than what they would have expected. So in some cases, while there's all of these tools that are out there and some options, they're not necessarily being deployed right away because they need to make sure that they are reliable. So that's one of those experiences that we've had here in the UK, and which is why they're sort of sticking with that traditional swab test. But then we know all kinds of issues there as far as accessing kits and then all of the products needed to process those tests.
Now, before we conclude, Crystal, obviously you are in the UK. You have a lot of experience with what is happening in your country in terms of numbers. And right now, it's fair to say that the numbers are going in the wrong direction. As we look at other countries, Spain and Italy, for example, affected by this crisis a lot earlier than we are in Canada. Are we seeing, is there any indication that those countries have hit or at least are close to their peak and the worst may be behind them?
We continue to watch that, and officials are obviously paying close attention, saying that the increases are not as big as they had been over a larger chunk of time. And it's important not to just look at those day-to-day numbers. That being said, our numbers are going up here in the UK. We know that we were sort of following Spain and Italy, and that's what we're seeing. More positive tests, more than 55,000 individuals infected, more than 6,000 lives cut short. So while there may be a bit of a turn in other places in Europe, that has not happened, at least here in the UK yet.
Yeah, and that's the big problem. I mean, and if people need any reminder of how serious the situation, you just have to look at what is happening to the Prime Minister of the UK right now. And you wonder if this is going to really provide that extra jolt for the people in Great Britain to really stay home and not just heed the recommendations, but the orders.
Yeah, it's not a recommendation. It is a lockdown, and people are paying close attention and maybe a little bit more now with the shock of Boris Johnson. Anthony?
All right, we will have to leave it there. Crystal, thank you so much, Crystal Goomansingh from London.